Thank you very much. So today when we talk about as a mood, thing is quite a broad topic, and I think that the focus of this talk will be more to spread to the audience. Here we have a lot of students, we have clinicians, we have also citizens that are interested in this new activities. So I think what our aim is to give information that will be very helpful to take informed decisions, but also with the aim of holding a little bit of discussion, also of the use of these treatments, not just ketamine, which can be used immediately, but also psychedelics. So in a hope that in a few years, course ketamine will be possible to do research and to use everything and other psychedelics as a table treatment. So, first of all, I think first better to step back about 110 years. We are now in this beautiful theatre, but this theatre and I believe the entire city of Rovereto 110 years ago was a pile of rubble. And the reason was that, here they fought very hard during the First World War. Thousands of soldiers died, a lot of civilians died, and the city problem was left in very few civilian civilians. But then the city was rebuilt, the region was rebuilt. And one thing is beautiful that now a few years of kind of even the students from the area of Austria, for instance, they come to study here. So somehow, more than 100 years, a lot has been killed. So I think we should think about, and I know this picture, this is sort of the symbol of Rovereto, this is the band of peace. It's a band that was done after the First World War, medically, a lot of camels. So somehow they made from us the instrument of death or the instrument of peace. And I think what we hope is that our study, our research, our physical activity somehow will bring healing and peace all over the world, because unfortunately we should be many bears like that, in the Middle East, in Ukraine, and in Africa, and in a lot of places. So I think it's important that what we do is not just people and scientific, but I think probably a wider social utility. Okay, what is ketamine? So ketamine is a molecule, probably all know that, and ketamine was discovered in 1962. And was approved in 1970 as an anesthetic. And this is very important because ketamine is one of the many molecules in medicine that they have a second use. We have right now with antibiotics that become antidepressants, we have antispastic that become a treatment for alcohol, we have antihistaminic becoming antipsychotic. So even ketamine from just an anesthetic became something more to that. Ketamine itself, it's actually is a setting. So we have two molecules, one has ketamine and they are ketamine, but we will discuss that later, but I think it's important to understand that. Then look at this picture. I put this picture because again it's another war, it's the Vietnam War, and ketamine was first used during the Vietnam War for a few reasons. The one reason was that the ketamine is very safe. Compared to morphine that at that time was used for injured soldiers, ketamine does not cause any respiratory depression and is safe in terms of cardiovascular side effects. So if you are in the jungle, probably you better to inject someone with ketamine rather than morphine than maybe the FLS. And this is something that this is not very well in the lab. So ketamine is very used in children, so it's quite helpful. Unfortunately, also what the government thought was that ketamine was going to be not liable to abuse like the morphine was, and at that time they had a lot of problem with heroin. But unfortunately, ketamine is the lack picture. We need to be aware of that because scary. It's an important caveat that we always. Ketamine can be given in many ways. Mainly can be given as an intravenous infusion or intramuscular injection, as a nasal spray, particularly Spravato, that is new for as ketamine, but can be given as a tablet, can be as an oral tablet or as an lozenges. The difference between the two is that lozenges can be put under the tongue, that is so that they bypass the liver as the first passage, so the effect is stronger and faster. But I think what we need to understand is that ketamine is licensed only as an anesthetic. So we do in medicine often, a lot of medication we use for daily basis are off labels, but we need to be aware of that. So for instance, it can be ketamine used of label as a sedative. As a daily treatment, both in acute pain and chronic pain, and later we are very interested in talk about that. But there's nothing the rest. I think ketamine is the first of this new gas rather than be arrested. So I think it's very important to keep this in mind. And there can be result of addiction, for treatment of addiction and other uses as well. So how does ketamine works? I think ketamine works in quite complex way. It is a non-competitive antagonist on the DNMDA receptor. It seems that at the prefrontal level is in a way stimulating the prefrontal lobes, and seems to be why there is a such fast activity. Within minutes, people treated with ketamine experience improvement, but also seems to work on the immune receptor. So that can explain at least in part the pain, the activity on pain. But I think what is the most interesting is not the neuroplasticity. Neuroplasticity is that phenomenon of forming of new synapses and new connections between neurons. And now there is also the evidence, possible evidence in humans as well, that people treated with ketamine that respond to the treatment also have a positive correlation in terms of formation of new connections. So somehow this neuroplasticity happened also in humans and seems to be associated with good response to ketamine. As I said, ketamine there are two molecules, S-ketamine and ketamine. And this is important because we know that the efficacy of the two molecules is different. Again, it is another question I think we will not answer now, nobody probably answer now, but we need to keep in mind that there is a debate. Is it better or is it more efficacious? S-ketamine or racemic ketamine? We don't know yet for sure. Some people say that racemic ketamine having two molecules in a way that have different metabolites somehow, active metabolites as well, somehow gives more the molecules and delta G effective in the brain. But this is another question that probably the research in the next few years we will answer this question. Okay, so let's focus now on depression. Ketamine is used for treatment of major depressive disorder. But again, because we need to give the right information, this is not for everybody. So the use of ketamine is in treatment-resistant depression, TRD, and this is different means. TRD is defined as a form of depression that remains even if the patient is being treated with a full-dose treatment with two antidepressants. So if you have a patient that approaches you with depression and to be treated with ketamine, if it's not treatment-resistant, usually it's going to swing back. The treatment-resistant depression is very important because about 30% of patients with the major depressive disorder suffer treatment-resistant depression. If you look at the numbers worldwide, it's about 100 million of people, so it's huge. It's huge. It's double the population of Italy, really. And if you look at the cost, we all know that depression has a big economic and social burden on society, but then we can see that more than 50% of that is caused by treatment-resistant depression. So I think this is a clear emergency that we need to treat better than what we do now, and ketamine and other psychedelics can be at least part of it. So we can use racemic ketamine and S-ketamine. S-ketamine is the only medication that is licensed in Europe, in the States, probably in the world, for the treatment of treatment-resistant depression. So why we need racemic ketamine? We go off-label, which is fine, but we need to follow certain procedures. With Spravato instead, with S-ketamine, we just follow, we follow more or less the same procedure, but it is a route. So how what we do practically when using someone with ketamine? We are realizing with every medication But every dosage has a different effect. You see microdosing and you see that, and the idea is the dosage that makes the person. So, I think what is fascinating with ketamine is that this is really personalized medicine because everybody's different and their dosage is different. So it's very important to assess the patient first and try to find what would be the right dosage for them. So normally if you want to achieve an antidepressant effect, the dosage is between 0.5 to 1 milligram per kilo. If we go above that, and often we do, then we achieve more dissociation. Perhaps that would be even considered a psychedelic effect, or we can achieve an anesthetic effect. What I think is very important with ketamine that is, this is important to stress the onset is very rapid. So compared to all other antidepressants, the onset is very rapid. Within a few minutes, the patient will receive something, and often as we eat, but also, this is very important for patients that have suicidal thoughts, also often these thoughts dissipate. So this is, potentially a life-saving treatment. So clearly, there are a lot of protocols. I mean, now ketamine is used worldwide. Every clinic has a slightly different protocols. There's different ways, so we're not going into the details. I think generally we can divide the treatment into phases, the induction phase and the maintenance phase. The induction phase is when people are assessed of force and then they're treated intensively with ketamine. So intensively generally we get chemical rejection or infusions or injections per week, sometimes 3, it depends. And generally that happens for 2, 3 to 4 weeks. So basically they can get to 6, 8 or more infusion and/or injection. Here every single infusion agrees on the real pleasure of the patients, and at the end we can have different outcomes. The very best outcome is the complete healing. The patient doesn't need any treatment, it's on rest and it's fine. Unfortunately, this is only a small fraction of patients. Most of the people recover, but they can carry on treatment with an antidepressant, mostly SSRIs, and it's fair to say that also people that have an SSRI, often people do not suggest to discontinue SSRI very carry on. The motivation there should discontinue if you want to go for a treatment ketamine adolescents. But other patients, and probably probably 40-50% of people that go to this treatment, there is some kind of signal. So there is a top up every few weeks, every few months, it depends, everybody is different. So when the mood starts declining, they get this infusion or they get also oral ketamine, and then the mood picks up, and then they can carry on for a few weeks or 3 months. I think this is also another probably very good outcome, considering these are people that are very disabled by the depression. However, there is also a small percentage of people that are not responding or even worse during the treatment care. So we need to be clear that this is not a panacea for everybody. So when but then I think what we now the next step of the treatment with ketamine, it's a recovery part with psychotherapy. At the end, this is nothing new in a way. In Europe, since the 50s, people used to do psychedelic therapy. They used to give LSD and then psychotherapy. So also with ketamine, a lot of researchers thought that would be a good idea to associate the treatment with ketamine with a sort of psychotherapy, we call also ketamine-assisted psychotherapy. The rationale for that is that people might be more able to respond to the treatment, to psychotherapy, but also because there is also this neuroplasticity, the effect might be long-lasting, the effect of psychotherapy. And so most of the people think that it's more effective than ketamine alone, although this is, again, if not set in stone, then we should be worse at that. The setting as well is very important. Unfortunately, we don't look much at the setting where the ketamine is done. It's very important. We don't need just really without things, but I think we should consider it. But again, this is another ending of not just discussion, but also results. So what we have, I think we don't know which form of psychotherapy is more effective. Is it cognitive therapy? Is it psychoanalytic therapy? We don't know. Probably there is not just one. I think again, if what is different, my views that probably should be fair on the facial experience and abilities. There is not also consensus what in a way is the window of opportunity. Is during the session, 2 hours, 2 days, we don't know. I think there's still a lot of research. And again, we don't know what is the very long-term effect of CAP. After 20 years, 40 years, 50 years, what comes out, we don't know. Now, ketamine as well is effective in chronic pain. And again, this is another condition, active hallucinatory depression, that has a very heavy burden on the individuals, so that faculty, but of course on the society in general. And chronic pain also comes with a lot of other problems, often patient chronic pain at the breast, and often in patients with chronic pain are also more susceptible, or at least of developing an addiction, because clearly the lipopids and other treatment that normally we did for pain treatment, they don't work, so they tend to escalate and then they get really addicted. So the new addiction that is even bigger than the issue. There are, again, it's complex, there are different mechanisms that definitely can seems to reduce this adjunctivity of the training pathways that are presented for the pain. Clearly the alcohol from the new receptor is cooperative with the opposite receptor as well. But I think what is very interesting is also the effect on the pain clearing by negative emotions, because it is truly well known that chronic depression and chronic pain go hand in hand and becomes a vicious circle. Worse is the pain, worse is the depression, and so on. So I think in a way, ketamine can be destructive on that, and this is something that I take with me. There are, of course, side effects in ketamine, because clearly ketamine, it's a drug, yes, it's safe, but should be given in the clinics under medical control. People can have, of course, shock or allergies, and that's something we cannot really predict. But also people can have sound arrhythmias, nausea, vomit, and sometimes dissociation might not be such a thing, so people that be that distressed. It's they can be very confused and delirious, but this is something. The other thing that we need to be very aware now in an area starting to become a problem is serious and aversion, because clearly these are treatment with a very powerful substance with high risk of dependency, so I think it's very important to avoid to eat getting into the body. With that actually monitored, because it can clearly misuse, the diversion and addiction can be a problem. However, chronic use of ketamine can also for urinary kidney damage, and with the K bladder, where is this fibrosis of the urinary bladder that can be very, very painful and disabilitating. However, as far as I know, there are no cases of people treated with therapeutic ketamine that ever came back. This is something we want to happen with. But of course, for the future, there are a lot of questions that we have. How long is the efficacy of the ketamine therapy? What are the long-term side effects? Is dissociation necessary or not? Is it a good thing or not? Some researchers think it's not necessary. Other people think it's very important for the experience. Which delivery method is more effective? Is the doing psychotherapy better than therapy alone? Which is plasmic ketamine better than the entire only, and are there new ketamine analogs that have the whole effect? But now let's stop, because I think now Michèle will talk about her experience, and we should listen with interest and respect, because I think it's very, very important to hear from the individuals outside how ketamine can be life-changing. Thank you.
Okay, so I'm learning that sharing personal experiences of therapeutic psychedelic environments and just stories is very important. We've already heard two, and so I wanted to share my story. And I use this quote from Joseph Campbell, "The darkest caves have the brightest treasures, because that's me in the middle, about 8 years ago. After I was hit by that car there on the left side of the slide, in my part of my leg in the headlight. And I never knew about MAPS in this moment. I didn't even know about ketamine. And so this experience in my life, which was the darkest cave, actually has brought me here today, and has brought us all here today. Because I think without this experience, I would have never met Federico Metastasio, who actually told me, let's do this, and immediately said, okay. So I just wanted also to put up the 4 beautiful humans, the surgeons from the University of Potenza Hospital in Basilicata in the south of Italy, who saved my life, and they were instrumental in having me be here today as well. So I'm going to share my story of ketamine. So my diagnosis was PTSD, severe PTSD or complex PTSD. I had a traumatic amputation at the left leg, and it took about a year for my lower limb to heal, and that's a picture there in the upper quadrant. Because of the traumatic way that the amputation occurred, there were many infections, and obviously this caused great depression, great unwillingness, to actually stay in this world and be here. So I was giving IV Tylenol for the first 7 days in the hospital, and they said, I'm feeling a lot of pain, what are you giving me? And they said, oh, we're giving you IV Tylenol. I said, don't you have anything stronger? And they said, well, we can't really, give you, maybe we can give you some opioids. And I said, okay, give me some opioids. So 10 days after this incident, and you can see my little limb there, and the radiograph, I came back to my home in Florence, and I was given all these pills. As you can see, these were actually a real photo of the pills that I was taking. I was taking OxyContin, which is an opioid. I was taking Lyrica, which is an anticonvulsant medication for epilepsy and neuropathic pain, but also for anxiety. And I was taking a very powerful medication called Effintora. It's a sublingual form of an opioid, so it's fentanyl. And I actually became very dependent on that medication because the pain was so severe that I really didn't want to be here. I also tried EMDR, a rapid eye movement to kind of follow the line, and I tried acupuncture, but nothing worked. Nothing could alleviate the pain, the physical pain that I was feeling. And it's called phantom limb pain. And a lot of veterans from wars get this if they've had amputations. Basically, what happens is you feel the pain of what happened right before your limb was amputated. So I was continually feeling the pain of that car that had taken my leg off on the street. I was on the back of a Vespa when this happened. And I just could not live. I could not work. I left my job at Novartis. I was the head of the scientific group looking at the pneumonia, kind of immunodominant proteins, and I said, I can't work, I can't eat, I can't leave. Isn't there anything else? I went to some doctors called Medici del Dolore in Florence, and they said, we don't know what to do with you because usually we give people opioids because they're going to die, but you're not going to die, so we don't really have something for you. And I said, there's got to be some kind of medication that can help me. And they're like, no, you're taking it. And I said, okay. So after 6 years of this, a friend of mine said, God, I heard about this ketamine thing. Maybe it can help you. And I said, oh, what's ketamine? And he said, it's an anesthetic. Let's get you some. And so this kind of started my journey with ketamine and understanding all the goodness, the biochemistry around ketamine. I actually went and did the CAP training program at San Francisco Polaris Institute, so I could learn about how ketamine works for depression, but this was more for my pain. So ketamine's untapped potential in Italy, and that's kind of why I'm here. And we have a workshop on this tomorrow, and I'll tell you more about that. But so I self-administered ketamine. And actually, Antonio told me about this doctor, this French doctor, Olivier Addison, who actually pioneered off-label use of baclofen for his alcohol use disorder. So there is a precedence for people, self-administering drugs, using them off-label, and then helping their symptomologists. So I believe that a similar progress can be made for people here in Italy. This is actually an article Phil Wolfson, who's the head of the Ketamine Research Institute, and I published in September, and we put forth the hypothesis that intramuscular ketamine at sub-anesthetic doses can actually cure phantom limb pain. I had 2 sessions, self-administered ketamine, where I went into a non-ordinary state of consciousness. I had never tried ketamine. It was the first time. I was quite shocked at how intense the experience was on my couch. Somebody was sitting with me. And after days and days of agonizing pain, this was on the 6th of January, 2022, 40 minutes later, I came out laughing from the experience, and I said, wow, that was really intense. And I never had pain again until November of that same year. So I was coming back from the Biennale in Venezia on the train, and all of a sudden, phantom limb pain, you never know when it's going to rear its head. So you're always hypervigilant if you start feeling shocks of, nervous system things. It's like sticking 10 fingers in an electrical socket and then being electrocuted. Maybe for a minute, maybe for 30 seconds, maybe for 4 hours, maybe for 2 days, 3 days, 4 days. You never know. So you're always, wondering, when is it going to happen? When is it going to happen? When is it going to happen? When is this pain going to come back? So I was on the train, all of a sudden, the pain was coming, the pain was coming. They said, oh, shit, here comes pain. And I arrived in Florence, and I was already screaming, and I got the person to get me some ketamine, and I self-administered again, and that was the end of that. And since then, it's been 2 years this month since I've been pain-free. I can live a life that's quite beautiful and quite fulfilling, and I feel that if my pain can help other people, my experience of pain can help alleviate the suffering of other people, then my life has been fulfilled, because that's an incredible privilege for a human to have. So tomorrow, basically the question was, why did I get this medication? I've been suffering for 6 years, and nobody in Italy told me about this. Nobody. I said, don't people know that ketamine can cure pain? And so I started talking to people, and medici del dolore, and not many people know about this, or not many people are talking to each other who maybe know about this. People, maybe some medical doctors are using it in, isolated pockets, and that's it. So the question was, can we use off-label ketamine for things like pain and depression? That's not Spravac. It's just Ketamine, HLC, ketamine. It's not patented. It's cheap. Let's get it, let's get it into people who read it. So I just want to plug this workshop tomorrow. There's another half day tomorrow about the emergent therapies conference. And it's a legal workshop, and our question is off-label ketamine feasible in our country? So Claudia Moretti and Manuel Verduga from the Association Capuchone leader, Carla Giuffre, Caterina Bertoli, Antonio and leader. And it's basically a multidisciplinary discussion. We want to educate people. We want clinicians to come. If you're using ketamine, I met someone last night at the dinner that was using ketamine with her patients. They want to, discuss what the clinical and scientific evidences are. We want to create a case and explore legal and regulatory aspects and address all the ethical issues that there may be. And so we're going to do this tomorrow from 9 to 11, and we're going to have 2 breakout sessions in this workshop, specifically for the medical and clinical and scientific group, and then the legal and the ethical group. So if you are one of these people and are interested in helping us create a roadmap for the off-label use of ketamine in Italy, please come and join us, and let's do this. Let's do this. Thank you very much.
Vous avez des articles